Center Universitas Pajajaran, has joined with us today Dr. Eduardo Gomez, the senior lecturer from International Development, King's College London. Dr. Ed, thank you very much.
Thank you for having me.
It's nice to have you here. Yeah.
Same here.
So actually, you look at what is called by nutrition transition, and you look at it in different countries. What is exactly the nutritional transition?
Sure. Well, the nutritional transition is, it takes a historical approach at looking at countries and individuals and how they change their dietary and physical activities. So for example, it explains how dietary patterns and physical fitness or physical activity patterns change over a long period of time. And so people that focus on nutrition transition look, for example, at how and why particular countries, say Indonesia, started off with diets that were more traditional, such as meats and vegetables that are traditional foods, looking at people that were more active, and then over time, looking at how these diets changed. So for example, people starting to consume more meat, more fatty foods, more artificial sugars, and then also physically, how people became less active in Indonesia from, new jobs and technology. So people that look at nutrition transition look at these changes, individual changes in diet and physical activity over time and the associated diseases that come along with it. So for example, historically, you may not have had as many cancers, you may not have as many hypertension or heart attacks because of the increased physical activity and more healthier diets. Now we're seeing all these different kinds of diseases that are emerging from these new foods, McDonald's or Pizza Hut, and then all the high blood pressure and type 2 diabetes that are emerging. So people that focus in on nutrition transitions look at how these changes in diets and physical activity lead to new kinds of health problems. Yeah.
So you look at this transition, especially in BRICS countries. So what are the similarities or differences?
Sure, the similarities and differences between the BRICS. First, I believe there are a lot more similarities than differences. In all these countries, you've had an increased consumption of several different new products. Meat, for example, consumption has increased dramatically in all these countries, either due to more production of meat goods or from import of meat goods. Also, there's been an increased consumption of sugars, artificial sugars, sodas, candies, a bunch of different foods that have artificial sugars. That has dramatically increased in the past 20 years. You've had also changes in physical activity, so less physical activity having to do with new kinds of jobs where people are required to sit down for a long period of time, to use the computer or the phones for a long period of time, or even handheld devices. And so I think these are all similarities, and all these factors have contributed to weight gain, to diseases. But one thing that's been very different is who in these societies have had more access to these foods. And then I would argue that in Brazil, a greater percentage of the poor compared to India, China, Russia, and South Africa has had a more access to these higher fat foods. And that's because of a anti-poverty program such as the Bolsa Familia that's given families more disposable income. And ironically, for an effort that was trying to eradicate poverty and malnourishment, in the end, the Bolsa Familia program has in a way contributed to malnourishment. And if you look at overconsumption of fatty foods, you see more overweight and obesity among children. Children receive, getting type 2 diabetes because the families have had more access to income and been able to purchase fatty foods through local stores, through the money that they get from the government. So overall, it's been really startling to see the rise in non-communicable diseases due to these changes in diet and less physical activity among all of the BRICS. But I would say that there are more probably similarities for the reasons I mentioned than differences.
Okay. So our data suggests that Indonesia rather experienced different transition in nutrition. So there is this interesting fact, which is there is an increasing obesity, but at the same time there is also a persistent malnutrition. So what do you think about this?
Well, I think this is a very unique phenomenon, and I believe the reason why again has to do with the different populations that have access to different kinds of foods and income. So the reason why I believe that both are happening is because with obesity, you have higher income, middle income class that have access to more fattier foods, processed foods, high sugar foods, ordering food to take home, whereas there's still a high percentage of the population is very, very low income that are not able to obtain these foods and are seeing high levels of malnutrition and maybe in some instances starvation. So I think that these are the reasons why you're seeing these two disparities in Indonesia.
Recently, you just published a book on geopolitics in health. To our general audience, can you please explain more what you mean by geopolitics and why is it important to public health issues?
Sure. So geopolitics it looks at the relationships of governments to other governments' international sphere, but also how governments relate to the international organizations and communities. And so there's many different theories in political science that talk about why countries engage with other countries at the international level. But geopolitical politics and interests has to do, in my book, about what interests and incentives governments, in this case the BRICS, have in working with the international community, working with the community in terms of receiving technical assistance, financial assistance, or on the other hand, trying to increase the government's international reputation as a nation that's able to combat disease effectively. So this book, as a key causal variable or motivation for policy reform, this looks at how political leaders situate themselves in the international sphere in two main areas. On one hand, building an international reputation to have an effective democracy combating diseases, and on the other hand, to what extent they're willing to work with the international community, receiving financial assistance, technical assistance. And this is important for global health because, as all of us would argue, public health is global health. And so a lot of times in these countries that are emerging, because they are new emerging economies, they do need help in financial assistance, technical assistance. And so it's important that these countries work closely with the international community in times of public health crisis to receive the additional support that they need, whether it be financial or technical, but also to share ideas and communication about public health issues. If they do take public health seriously and the health of their citizens seriously, they will take international relations seriously, because I believe a lot of the policy solutions to the domestic level have occurred in other countries and are available at the international level, and countries need to be receptive to these ideas and experiences to have an effective domestic policy response.
Okay, so in your book you mentioned that Brazil is an exemplary in how it responds to health epidemics. Can you please explain more what it has done? Sure.
Well, Brazil was the first country in the Americas to really successfully tackle the biggest epidemic of our time, which is HIV/AIDS. And so in 2003, Bill Gates gave Brazil an award for having the best international response to the AIDS epidemic. And what Brazil did was two main things. First, in the area of prevention, it worked very closely with civil society in increasing awareness about the HIV/AIDS epidemic, finding out, working closely with NGOs about what they needed, the information they needed, the assistance that they needed. And this, as I talk about in my book, had a long history that went back to the early 20th century with the government working very closely with civil society, which wasn't present in the other BRICS nations, which I thought was very interesting. On the other hand, the government was very committed to providing treatment and medication for everyone in Brazil. And so in 1996, Brazil was the very first country in the world to require by federal law the availability of ARV medication to everyone in need, regardless of your status. That dovetailed with the universal healthcare system. So the distribution of drugs was able to benefit from the universal healthcare system in SUS, which is the Sistema Único de Saúde, the unified healthcare system, which is decentralized. So because of these two things, Brazil was very successful in reducing the number of HIV infections, helping at-risk groups such as prostitutes and drug addicts and the gay community, and really decreasing the number of AIDS cases over time dramatically at a much earlier time when compared to the other BRICS countries. So that's why I think it was very successful and innovative and different from the other BRICS and arguably other developing nations.
So last question, Ed. For Indonesia, what do you think we can learn from BRICS experience?
Sure. Well, I think there's two major things that lessons that Indonesia can learn. First is that, like Brazil, India, and China, Indonesia may benefit from working very closely with the international community. That is, working with the WHO, the World Bank, or the Asian Development Bank, and receiving ideas and maybe even financial assistance in tackling diseases that are increasingly becoming a burden at domestic level: AIDS, tuberculosis, obesity, diabetes. The second major lesson is that it's very, very important to work closely with civil society, in working with civil society and monitoring how policies are being implemented at the local level, making sure that mayors are being held accountable for how money is being spent on prevention and treatment. And I think Brazil has showed the best example of how that can happen. So I think these two issues, working very closely with the international community, but also the government working very closely with NGOs in a way that helps them increase accountability at the local level. I think these are the two main lessons that Indonesia can take from Brazil and the other BRICS nations. Yeah.
So thank you very much, Ed, for your insight.
Thank you.
That's it for today. Don't forget to follow our social media account on YouTube, Twitter, and Facebook. Please also visit our website at www.sdgcenter.unpad.ac.id.